Have you been treating small intestinal bacterial overgrowth when in reality you should be putting your attention towards H. pylori? Well, what's going on there? Well, let's talk about this. So, if we look at small intestinal bacterial overgrowth, as the name implies, that is an overgrowth of bacteria in our small intestine. One of the things we have to ask, however, is not just how to reduce that overgrowth and get those numbers back down to below threshold, but we also need to ask the question of what caused this to manifest in the first place. And many times H. pylori can be a factor in that. And so H. pylori is a bacteria that we find in the stomach. Many people have heard of this. Many people associate this or know this as it relates to ulcers, potentially developing stomach ulcers. But there's a bigger conversation that needs to be had here as this relates to small intestinal bacterial overgrowth. And especially if you know that you have a B12 deficiency with your small intestinal bacterial overgrowth, that is a strong indicator that you need to be thinking about H. pylori as a causative factor. Here's what happens, guys. H. pylori is known to damage the cells in the stomach that secrete acid. We call these cells parietal cells. In addition, those cells also secrete something known as intrinsic factor, which helps with the uptake of B12. They also secrete gastroferrin, which helps with the uptake of iron. So therefore, don't be surprised if you also have a need for iron if this scenario fits for you. But what's important to note here is that naturally, as these bacteria are moving through our upper GI tract, through the esophagus, into the stomach, into the upper small intestine, is that we should start off in the stomach with an adequate concentration of acid that's going to create a low pH that is in turn going to reduce the overgrowth, reduce the numbers of bacteria that are going through the stomach. And if those numbers of bacteria are reduced in the stomach, then they're also going to be reduced in the small intestine. They're going to be lower when they reach the small intestine. But unfortunately, what happens many times is that because H. pylori has persisted, because H. pylori has been allowed to continue to proliferate, that H. pylori has damaged those acid-secreting cells, and that acid is no longer there in sufficient supply to be able to reduce those bacteria that are going through the stomach and then ultimately down into the small intestine. If they're not being reduced in number, that means that there's going to be a greater quantity that are reaching the small intestine, ultimately to the point that this begins to push past what is considered an acceptable number of bacteria in the small intestine. And now we've got a case of small intestinal bacterial overgrowth, where symptoms such as gas, bloating, painful distension in the stomach, pretty frequently after a meal. Maybe we see indications of changes in motility, could be slow, could be actually fast, moving towards diarrhea, could be an alternation between those, potentially seeing indications related to changes in weight. These are all things that are linked to small intestinal bacterial overgrowth. But again, asking the question of what is it that set the stage for this overgrowth? And in those individuals who just haven't been able to put their finger on that, it could be H. pylori. Now, let's talk about what you do about this, because there's different options on this. And so when it comes to more of a conventional approach with H. pylori first needs to be diagnosed. And we also need to know if H. pylori is secreting virulence factors. These are proteins that are secreted by H. pylori that are showing greater potential for damage against various tissues. However, when we look at just an increase in the number of H. pylori period, that should also raise our attention. So we need to, if H. pylori is present in excessive amounts, that's concern in and of itself. But if it's secreting these virulence factors, that's even more of a problem. So those are things that we need to know. In addition to that, we want to think about how do we deal with this? Well, we can use antibiotics. Many times single antibiotics are not employed anymore. Sometimes 3, maybe even 4, maybe even 5 are a part of this strategy now. So that's one avenue. But what we can also effectively use against this are antimicrobial botanicals. They're very effective against H. pylori as well. And there's quite a bit of data out there suggesting that botanicals can be effective. Many times individuals will look towards a botanical known as mastic gum. I would actually argue that mastic gum is average in terms of having an effect against H. pylori. I think that when you look at the information that we have in terms of other botanicals that can be effective against H. pylori, it really makes more sense to use a combination of botanicals as opposed to just leaning so heavily on mastic gum, which is historically what the thought process has been. Many times, and this is not unique to H. pylori, this is more of the mindset when it comes to dealing with all types of organisms that need to be reduced in number, is that often a multimodal, multi-mechanism of action approach is going to have a greater outcome than being solely dependent on one mechanism of action. So that concept is true as it relates to mastic gum. That concept is true as it relates to antibiotics. And so, mastic gum, again, not bad, but it's going to have a better outcome if you combine it with other antimicrobials. Now, all that to say that H. pylori may be the driver for your small intestinal bacterial overgrowth. And if you're not finding the resolution that you need from going through the process of trying to reduce that overgrowth, then don't forget about H. pylori as a potential option that you need to look at. So until next time, guys, I am Dr. Arland Hill, and I will talk to you soon.